Looks like we're good to go. I just saw myself on the Facebook page making really big eyes as we went live. So
Did you
I
do
think,
any touch-ups? I didn't. You seemed comfortable with your appearance.
yeah, I did that before I got on camera. So luckily, yeah. How's your week been, Alex?
Oh, it's been great. We were just talking about before going live about how cold it is in so many areas. And one of our guests who is in the waiting room will be coming on later, talking about pipes freezing and things like that. So I, knowing that a cold front was coming in, just getting the house ready for that. And I don't want to go out because it's just so bitter cold.
Yeah. Yeah, I had to escape to the desert to Palm Desert actually, where it was warmer, still in the high 60s and 70s, just to get out of all the cold. Talk about pipes freezing. I had that happen to me a couple times this winter already too, and
In the RV?
in the RV, yeah. So the water coming into the RV, I had to boil some water and go out to my water spigot and pour the boiling water inside of it to, free up all the ice that was in
Oh my
there.
goodness.
You learn.
You turn your own butter while you're at it too? Just like you're kind of going, you're de-evolving. You're going back into pioneer times, Dave.
Great. Churn my own butter. That's awesome. Yeah, I squeeze my own almonds for almond milk and
Yeah.
it's good stuff.
Oh man. Well, so you're in Palm Desert now. You last time we were with you, you were in Malibu, and the fires were kind of near you.
Yeah. Yeah, 2 weeks ago was down just a couple miles outside of where the Palisades fire was happening. And luckily just made the right turns at the right times and didn't get stuck or caught in any craziness. So
Good.
yeah, heart goes out to all the people that are in that area and affected by it. It's just we live such relatively fragile lives that even the smallest little thing that throws off our just the wheels of, society can
Yeah.
really disrupt us. And in a way, I think it's kind of I'm not saying anything about this fire, but that disruption in a way can be good for us to kind of
Yeah.
keep us on our toes and keep us not
Yeah.
complacent. Uh,
You know,
so,
um,
oh, sorry.
Oh, I was just going to say we have members in that area who may have been affected, and I'm sure they're not watching right now because they're probably trying to get their lives back together, or hopefully things are well. But if you know anybody in the area that has been affected that is an AAPC member, let us know, and we can send them, direct them towards the hardship fund and help them out however we can. There's a lot of great things that we can do for our AAPC family.
Yeah, definitely reach out. It never hurts to ask, and there's usually resources or some things that we can help out with just as a company. That hardship fund is really cool. How long have we had that?
Oh man. Yeah. Like as long I've been here 10 years, so at least that long, and you've been here longer than me.
Yeah. Yeah, we just don't talk about it a lot. Really only in maybe when times are a little bit more tight or there's disasters, but it's
Yeah.
good for our members to know that that is, have access to be able to tap in. So that's
Yeah. I guess wherever you may be. So even if you're on the West Coast, East Coast, if you're struggling or know a coder, a member who is struggling, you can just search for the hardship fund on our website and you can find details there.
as far as 2025 stuff though, um, we've got some fun things coming up. I can't believe HealthCon is already around the corner.
I know.
It's where we're just there. We're going to talk about that later today with a couple guests that we have, but just things are already moving right along. We've got also RevCon coming up, and I guess I could plug that real quick because that's coming up pretty soon next month, the 25th and the 26th. It's all about revenue cycle. So if you're somebody who's in a position in your organization where I mean, if you're a coder, you're part of the revenue cycle. You're all part of the revenue cycle, really. But some just more than others are in touch with different sides of it. RevCon's a really great small conference, and it's a little less expensive than our big HealthCon because it's just a smaller boutique virtual event, is what we call them, a boutique event.
Yep.
But yeah, we invite you to kind of look it up on the website because RevCon's cool. It's a
That
lot
would
of
be a perfect one to hang out in with your blanket on in this cold weather. You could do that with HealthCon too, because it is a hybrid event. But yeah,
Yeah,
from the
definitely.
comfort of
Yeah.
home.
Right. Take advantage of the snuggle weather, the cuddle weather, and cuddle up to a conference by
Yeah.
AAPC.
Well, I know you saw this too the other day. Sophia, our conference manager, sent out the email saying, "Hey, HealthCon's around the corner. It's time to start making travel plans." So I'm looking forward to it. Is Orlando's so fun, and we have a great group going out.
Yeah. I was telling the group earlier before we got on that I've been involved in a lot of conferences throughout the years, but it's kind of been peppered, and I've never been able to go to Disney World or the Coronado Springs location there. So I'm pretty excited about it. It should be fun. It's always a double-edged sword for me because as much as I love going to these places, it's like I also traveling is I don't know, I can be a bit of a hermit, which is funny because I live in an RV, but I don't know.
You
It's
are hard to get out. Like I just remember maybe he's in Nashville or Dallas a few years ago. I crossed paths with you late, and I was looking for food, and you're like, I'm going to what a burger.
I
You
was going
remember
to
that?
Oh yeah. Was
And
it
then
when you
so
had the van?
yeah, I think so.
Yeah, I
And then
had
I
to our rental van. Yeah.
yeah, so we went to I you let me tag along for Whataburger, and it's
It
pretty
was
good.
great. Yeah, I think that was at a point where it was like there was not a whole lot that was open around where we were at. And yeah, we saw each other and both starving. So we're like, let's go.
Let's go. Yeah,
What a burger and take the rental van there at, 10, 11 at night or
the
something. I don't know.
Dallas experience. I think
The
that was
Dallas.
Dallas.
Yeah, I think that was Dallas. That was the Gaylord Texan, I want to say.
Okay.
Yeah.
Okay.
That was fun.
Yeah.
Yeah. Conference was a good time. Well, I guess we should probably bring in Rhonda. We have
Yes.
a special guest today, and I already said her name. Most of you probably already know who she is, but Rhonda Buckholtz is with us. I'm going to let her in the room right now so she can get her camera turned on. Rhonda,
Hey,
welcome. We have the new NAB president, Rhonda, with us. So, Rhonda, how does it feel? How does it feel to be running the show now?
it can be a little intimidating, but in a lot of ways, it just feels the same. My time under Colleen and working even with other past NAB presidents, it's great work. It's invigorating, uh,
Yeah.
and a little bit challenging.
Yeah, I'm sure a lot of challenges, but you've been involved with AAPC for a long time, so there's a lot of experience that you bring to the table. Um, and really for our audience, we really kind of want to get to know you and allow them to just get to know different sides and different parts of you. So I'm going to ask you some questions here.
Okay,
How long you've been with AAPC? Why don't you tell us maybe how you got started or how long you've been a member of AAPC?
sure. I've been a member of AAPC since 2001. And when I joined, it was a much smaller organization, but it was also that whispered about organization where people are like, that exam, there were so few of the coders, right? And today they still say, oh, that exam, right? But it was one of those things that I had gotten kind of thrown into the rev cycle and the billing and coding at a family practice that I was working at, very first practice I ever worked at. And it just drew me and I really enjoyed it. And when I went for my certification, when I left that exam, I felt like probably most of our members that I tanked it, right? And I didn't. So I've been certified since 2002, and I really enjoyed the industry. I started auditing and I started teaching, and then I actually got on to the National Advisory Board back in 2006, I think it was,
Yeah.
back when, right when Reed Pugh had stepped in as president. At that time, he decided to blow the board up. And so it was a very short-lived board seat because he revamped the entire board, which needed to happen, and really changed the leadership and the building of AAPC. But it actually ended up then working into a job for me at AAPC. So I worked for the AAPC for, I think, just a little bit over or just shy of 10 years. And started out working side by side with Marty in local chapters. And then moved on to business development and building partnerships that way. And then, of course, the ICD-10, right? Uh, when I left AAPC, it was to get back and start working with the practices one-on-one to use my skills and to help work. So I've actually been working with and doing a lot of mergers and acquisitions, working with PE companies, and doing a lot of compliance work around that arena. But my passion never left. When I left as an employee, they brought me on as a board member, and I've been there ever since. So this next 3 years is amazing and kind of a dream come true for me.
You said that you were first part of the NAB back in '06, around that time, and it was
I think it was
short-lived.
around, yeah, 2005 or 2006. Yeah.
Rearranged things, and so
Yeah.
you were, but then you were an employee after that point. So I
Correct.
remember when I started, you were an employee already, and
Yeah,
we worked together a lot on that ICD-10
we
or
did.
9 to 10
Yeah.
transition.
Yeah.
So many webinars, and there
Those
was
were
so,
some wild and crazy times, right, Dave?
yeah,
Yeah.
that was so
Yeah.
much that went on during that time. Whenever are we going to hit ICD-10 11 at any point soon? Do I need to be ready for that?
No, I don't think so. And who knows with what's happening with the World Health Organization right now, right?
Mm.
And what our participation or membership is going to be like that, and what changes that might drive. It's going to be a whole new world, at least for these next 4 years, right? So it'll be interesting to see what politically happens. There's too many challenges with bringing I-11 on. If you look at the mappings and you look at the new code sets that come out, and of course, what's really fun for me is when we get new codes, I like to go then and look at what's the equivalent in I-11. We have way more specificity in I-10 than the current I-11 has.
It's just not built out.
No, so we'll either have to lose a lot of data or we'd have to do clinical modifications again. Those clinical modifications would take decades. But one of the challenges we had when we implemented I-10 was the loss of data that caused a lot of strife. So we had to do a lot of cleanup work. And that year after, and actually 2 years after implementing, trying to get things caught back up and fixed and made right so you could track that data historically. You just don't know. Do you need 65 codes for one condition, or right? Is the magic number 2 or 3? I don't know the answer to that, but and I don't know that we have the data to support any of those decisions.
Yeah,
Rhonda,
Interesting.
interesting.
Yeah.
I'm curious because that was a big question on Monday in the Facebook group, some places on social media, from coders saying, if we leave who, where does that leave the ICD code set with us? And then I saw some comments of reassurance saying, hey, our code set that we use is much different than what the WHO delivers. Can you kind of give us a little explanation of that? And do you have any concerns about that possibility of leaving WHO in the US?
Yeah, yeah. So I'll tell you, when I talk about I-11, one of my favorite things to do is to show a graphic that I put together that has a picture of my husband and I at our senior prom. That was when ICD-10 was talked about and adopted. And then I have a picture of my husband and I and my two fully grown daughters at my oldest daughter's wedding of when it came true. You see that age gap, right? So I always tell everybody, like, we've got to get things right. This takes a long time for us to move things with healthcare policy. I personally, honestly don't know what that would do for adoptions of future code sets if we pull out of the World Health Organization. That data that we exchange between countries is really important, and I imagine that will have to continue way. I also imagine that a different relationship with who will be developed once they work through what President Trump's struggles were with it and try to make it work for what he believes it needs to work for.
Okay.
Yeah.
So any apprehensions then? It sounds like you feel okay with
Yeah,
with whatever happens.
I do.
Well, knowing that any of these changes take a really long time to take place, it's not like we're gonna wake up and have to scramble all of a sudden. We're gonna know that things are coming and
Yeah.
yeah,
We
so
have so many other priorities on our plate right now that we need to be taken care of, that this should just be so far in the back of everybody else's minds.
yeah,
Right. The other innovations need to take place first.
that's good to know. And I like what you said about ICD-10 CM. As we have it now, we have way more specification or specificity and um yeah, and wasn't that the whole shift from 9 to 10 was getting away from memorization of codes that had no form or function or rhyme or reason to them, to a code set that made sense with every character being either laterality or
Yeah.
I'll stop there because that's the only word I know, laterality. But
Yeah.
yeah,
There, yeah.
it's a code set that just makes sense in and of itself. So hopefully ICD 1011 would be an extension of that or just even more specific. And if it's not, well then let's not touch it till it is, right?
Yeah. You got to drop the 10 out of it. You have to say just ICD 11.
Did I say ICD 1011?
Yeah.
That's hilarious.
It happens all the time, right? I hear people, it's like, nah, drop the 10. Right. Yeah. It's
And
just,
to 11.
it'll be interesting to see what happens. It really will.
Cool.
I'd love to say our data in healthcare is so well supported by this code set, but it's not. A lot of times the codes aren't being used appropriately. We see that all the time. I don't know if you guys have ever pulled your own health records. I kind of get a chuckle out of mine because they're almost always inaccurate to some point.
Really. Is it the
Mhm.
is it the codes that they've assigned to certain things that just are slightly off or just not correct?
Yeah, just slightly off in category,
Mm,
or maybe they made mention of a possibility and someone robustly pulled it in. There's a lot of problems with the data.
crazy.
As a
So
consumer, do you have any say in that? Can you say, hey, this is coded incorrectly?
Yeah.
Okay.
I do it all the time. I think my providers have a love-hate relationship with me, maybe more hate. Right. But I'm the one that'll go, this isn't going to work for me, right? I don't have these conditions and you didn't diagnose, they're not in my medical record anywhere, right? Not here at all. A lot of times, even in today's age, a doctor will order blood work and whoever's helping them or assisting them has their little cheat sheet that says, if he orders this test, use these diagnosis codes. It happens all the time. And those diagnosis codes aren't in my medical record. You can't use them, right? So I've declined many tests to go back and get accurate. And of course, the provider struggle is always that they want your health plan to pay for you, right? They don't want to have to hassle with all of the other stuff. So many administrative burdens that it's sometimes just easier to say, okay, yeah, we could make that stretch or we could do that. But I could tell and I have been through different presentations, stories of following patients, myself, my family, some of my friends' husbands and wives, and shown where the health system has failed and what they've done with data. Um, yeah,
Wow.
well, it's easy to make mistakes when we're all human, right? And we rely on these systems and but really awesome that you know what to look for in your own record, with your a lot of people don't. I don't think
right.
I wouldn't take the time even to go look up and make sure that everything was coded correctly. So, yeah. Um uh, so uh, So Rhonda, you are, what would you say is like your specialty then in like the whole revenue cycle? Because you seem to be well versed in a lot of different parts of it. So is there one area like specifically that you'd say that, hey, this is my specialty, or are you more of kind of a jack of all trades, Jill of all trades? There you go. A Rhonda of all trades.
So, yeah, I would say that if you had to boil me down, right, the biggest strength that I can carry is revenue integrity and compliance. I have a strong background in healthcare operations, which just makes me even better than at those other aspects. It's the type of work that I love to do. It's that kind of information that, like, I wrote my book on, right, on the consolidation gaps and the operational issues and the leadership issues that we have in healthcare right now. So I would say that that's really where my strengths are. My strengths are not in day-to-day coding. And mainly because I just don't do it on a day, right? Trust me, I know my codes and I know how to read the books and I can get you there, but it's not what I do on a daily basis.
That makes sense. You mentioned your book. Tell us a little bit about that. I don't know if
Yeah,
I was going for the same thing, but yeah, tell us a little bit about your book and when you wrote it.
yeah. So I wrote it this past spring, and it was kind of in a response. I sit in consulting and in different places that I've worked, and inevitably people think that they're going to solve their budgeting issues and by fixing it with technology or systems, right, or trying to change behaviors of physicians, and it doesn't work. It doesn't work because they don't involve the right people and they don't understand the complexities. And so, I use the front desk as a really good example of this. It used to be at the front desk, you had your smiling person there, your front desk people are so vital to an organization. But they were the ones that the patients loved and connected with, and that was really a core part of their job. Now you walk into most healthcare clinics and you're greeted by a kiosk and a front desk person that now has to have two monitors to marry all of the systems together to hopefully get you registered correctly. So
They're
now the emphasis,
behind those monitors.
right, they make and they use it as a shield, right? Because if they don't have to make eye contact, they don't have to help you at the kiosk, all right? They can just do their job and go. They don't know you've consolidated billing and rev cycle, so it's no longer in-house. So they don't have that person to talk to right there. So now there's no one left in the practice that's helping them answer those registration questions or make sure that people understand their bills. Everything you do adds that layer of complexity, and too many times those decisions, they sound good. The vendors make them sound really good. It's when they're in play, right, that you feel like you start to really lose that. So the book really focuses on, if you're consolidating, like, understand those three layers of leadership that you have, because they all serve a different purpose. You have your C-suite, you have typically your regional directors, and then you have your individual practice managers. None of them talk the same language. And quite honestly, they shouldn't. The message up here should never be the same message down here. And so it's just how to work those systems and to make sure that you don't suffer from those when you consolidate and try to build bigger and stronger, that you don't lose that.
Wow, that's cool. What was the name of your book? What was the title? You want to
It's
tell everyone?
called Consolidation Gaps, the Layers of Leadership.
Rhonda,
Consolidation.
grab it and hold it up to your camera so we can show everybody the cover. Yes.
Perfect. And where can we find the book? Is it on Amazon or
Amazon.
Kindle?
Yep.
Amazon? Cool.
Yeah,
Awesome.
it's on Kindle too, but Amazon. Yep.
That's great.
Rhonda, when I came on, like Dave, I was assigned, you're my first project as far as what you're working on ICD-10. But since, after you left, I saw you in the vision care world,
Yep.
and I don't know, optometry or whatever, but I had in my mind put you in that bucket within the vision world. Tell us a little bit about your experience there.
Yeah, so I spent probably, well, from the time I left AAPC, so 2017 to uh, to just this past year, I've worked in ophthalmology solely. I still had my clients through my consulting company with other specialties, the work that I've done there and that type of thing, but my day job was with working with PE-backed ophthalmology groups,
Okay.
mergers and acquisitions, compliance, due diligence, practice optimizations, those types of things.
Okay. So I wasn't going crazy. That there
You
was
were
truth
not.
to that.
No,
Okay.
no.
And have you ever served on a local chapter board or not a board, but as a local chapter officer?
Yeah,
You've
I
been
did, which is actually how I got my job with AAPC. So back in the day, Reed had another employee reach out to me, and somehow I had caught his eye, and he had asked if I had ever been a local chapter president. And I said, it's a long story because you guys know me, like most of my stories are going to be a little bit complicated. And so when I got my certification, I started going to my chapter, which is an hour and a half away from me. When I started teaching and was able to bring more in, we were able to actually spin off and do a chapter closer to me, which was great. Hospitals started buying up and people weren't getting jobs. I stopped teaching and because there weren't jobs available at that time. Remote wasn't a thing back then, right? And so we ended up consolidating because the other chapter actually started dwindling down. So we consolidated and we shared. So we actually had one meeting 1 month here, one meeting here, and we kind of worked back and forth and worked together. Then we ended up closing our chapter. The other chapter, I helped them get established. So I've been an officer multiple times back then. That's how I actually had interviewed and said, yeah, actually, here were the struggles. Here's what we did, it was really great.
So you got kind of roped in. Cool that Reed noticed you,
Yeah.
and reached out to you. So it's a good example. We never know that other people that are watching. And Reed was the CEO of AAPC. You never know.
Networking is so important.
Yeah.
I think people forget to understand just how important that is.
I'm
Mhm.
going to jump out of my seat because we talk a lot about this with social media and presenting yourself in a professional way on social media. And I know personally there are Vilt instructors and their assistants who get hired. AAPC has brought on people onto committees and just from how they help and interact with members and coders digitally in the digital world.
Right. It is so important. And so what I try to tell people all the time is, sometimes we're not the best at expressing our emotions, especially in a short post, right? Or you have a reaction to something. I always tell everybody, practice the pause, right? Just stop for a hot second. But if you're not good at expressing your opinion, run it through AI and have it help you rewrite it, right? Make it a little bit more user friendly that can help other people because sometimes we're really good at talking face to face and getting it across, not so great in the written word.
Lose a lot, or the tone can be everything.
Oh, right. Yeah.
So much. And
I can
context.
read something one way, right? And it can be interpreted something completely different by everybody who reads it.
That's
All
why I
caps
just
might be my quiet voice.
all caps. All caps are quiet voice. Yeah.
I love
Powerful
that.
quiet
Yeah.
voice.
Yeah,
I was gonna say that's why I just speak in emojis, but
yeah.
Right. I actually know someone that lost a job opportunity because she used all caps.
Oh wow.
Yeah. Yeah.
why did you yell at your recruiter?
Right. Why are you shouting at us? We're trying to hire you.
Oh, that's so funny. All right, Rhonda. So we've got just a little bit more time with you. But you've got 3 years here as NAB president. I mean, no pressure or anything, but what are you hoping that the NAB accomplishes, and what kind of things do you see in the horizon for you?
Yeah, so most people might not be aware that when you come on as the president, you work with AAPC to set your platform and what you really want to focus on in the next 3 years. And I'm really excited with our committees, our officers. We actually changed the board up this time because we usually have 4 officers. We have 5, and it was because we have new things that we want to accomplish and engage. And so the platform is all about empowering our community. And so our committees are lead, right? Unite, connect, um, employ, no, connect, empower, and cultivate.
Lead,
Um,
guide, connect, empower, cultivate.
yeah, yeah.
Luke, lead. I don't know.
Yeah, come up
We'll come up
something
with an
creative.
exception.
We are gonna have t-shirts for sale at HealthCon,
Oh,
with the
Atlanta.
committees on them with those names because we really want to learn to bring our community back together. There's been so much division, especially since COVID, and the whole workforce has changed, and there's a lot going on in healthcare where coders are getting jobs and losing them, and you didn't see that in past. It's mainly again because of the consolidation, the bigger companies, right? And so to bring our community back together. I'm so passionate about that piece of it, and just building our membership and the culture around our membership, I think is important. And that's what all of the programs are and committees are going to be working on.
Love it.
Yeah.
Cool. Well, thanks, Rhonda. Thanks for joining us and thanks for telling us about yourself and your history. And we're really excited to have you as the new president of the NAB for the next 3 years. And maybe you'll get reelected every year after that and
There's a rule on that.
you'll become queen of the NAB. I don't know. I don't know how that works.
Right.
Yeah, there's rules for that.
Yeah, I have a feeling after the 3 years, I'll still be on all of the other committees I'm on too. So
Yeah, it seems like you'll always be involved. Well, thanks, Rhonda. It's been good working with you too, and always excited to have you on.
okay, thanks, guys.
All right, we'll see you.
Oh,
Now
she's staying on. Rhonda's staying
Oh,
with us.
oh, you're staying on with this.
I'm
Oh,
here.
I thought you were
Yeah.
going away. All right, well, let's bring
Yep.
on Claire and Heather and let's keep this party going.
Hey, Dave, when talking about shirts and giving away stuff, I thought it might be fun. I got stuff in a box. This box here is full of AAPC swag.
Nice.
And why not? I'm just thinking, why not give away some stuff to AAPC members watching? So if you are attending HealthCon for the first time in Orlando, and Claire, you cannot, even this is not your first HealthCon, but as an AAPC employee, you are exempt from this one. But if you are attending for your first time, you can win these AAPC socks. They are quality socks. I have not worn them.
Have, and they're good. They are really good
They are good.
socks,
They're
people.
quality.
But you
I
haven't
love
worn
it.
that
They are
pair.
so good.
What's that, Dave?
You haven't worn that specific pair of socks.
I have not worn the specific pair.
Okay. New socks. Yeah.
These are fresh, yes. And let's see what else we got. So I've got this. This is new as well. It's from Nashville.
Brand
HealthCon
new.
2020 in Nashville.
Love it.
So I've got a few other things, but let's see if anybody new attendees will be attending HealthCon. Let us know in the comments, and then we'll give those away. If you guys have any ideas, this is open to anybody on this panel. If you have a contest idea, Rhonda, Heather, Claire, just throw it. I've got a box full of stuff, so the free game for all of us. So we'll continue and then just pick it up
So-
here and there.
What about the first person who is an inpatient coder?
Nice.
There you
Yeah.
Okay. go. Okay, let us know.
Love it.
I like it. Yeah, I'm trying to look at the chat on Facebook to see see what's coming. You might have to pull that up and monitor that one, Alex. So,
Got it.
but well, cool. We're gonna talk about HealthCon now. We're gonna shift gears away from the Rhonda's NAB excitement and shift into even more exciting things in April. So we've got HealthCon coming up. What are the dates? Is it the 5th through the 7th of April?
I think it's
6th through 9th.
6th to the 9th.
6th through the 9th. Okay, the 6th through the 9th in Walt Disney World, Orlando. And before we went live, we were talking a little bit about it. Claire, you haven't been. This is your first conference altogether, right?
No, I have been to HealthCon, just not as an AAPC employee.
Right. See, that's where I was
And not
confused.
at Orlando, right?
And no, I have not been to Orlando yet, and I'm pretty excited, not gonna lie, a little stoked.
Nice. Yeah. So are you a Disney fan?
I am.
You
Yeah,
are.
I'm a little bit of a nerd, not gonna lie.
Okay. So you'll be one of those just walking around singing all the songs and stuff.
Oh yeah,
Still have the ears on.
the headgear, yep.
Yeah.
Gotta do it all.
Nice.
Hey, when I
I'm
asked,
all for singing the songs and wearing the ears and having all that fun, just not the crowds at the rides and
Yeah,
like that doesn't excite me at all.
yeah, that's true. That's true.
Yeah,
But the
actually-
weather will be nice, right?
Yeah.
So, I mean, there's that. You'll be in line, but it'll be nice outside. So, and right now that sounds awesome.
Amazing. Yeah.
Yeah, I'd rather be waiting in line in warm weather than freezing in, what did you say, -1, Rhonda?
Yeah, -6.
-6. That's cool.
Hey, when you bring up Disney these days, it can mean so many different things. So you've got the classic Disney stuff, then you've got Marvel now, and you have Star Wars. Claire, where do you fit into all of that?
Classic.
Okay.
Yep.
Wow, just like that. Classic. We're talking Snow White, Cinderella,
Little Mermaid.
Beauty and the Beast, Bambi, Little Mermaid. Yeah, the golden era of Disney was like felt like was Aladdin, Little Mermaid,
Exactly.
Beauty and the Beast.
90s
I want
kids.
us to go and get dressed like princesses or princes,
That
right?
would be
They do that
amazing.
whole thing. Would that not be so much fun?
I'm down.
Right? Have a day where we all come as our favorite princess or prince or character. It could be another character.
Yeah, you say that, and Alex may very well dress up. So
Um, I've been told, so I worked at an amusement park for 4 years, and they on my name tag, I was a musician, but they put on my name tag Mowgli. So I actually thought, do I show up? Do I surprise Dave and dressed up as Mowgli? But the problem is Mowgli really doesn't have a lot on.
No. Yeah.
no, that's just the loincloth,
That would
Alex.
be a
I
surprise.
know. Yeah. And we would lose conference attendees with that. So we don't want that to happen.
That's
You will get
debatable, but
comments, that's for sure.
yeah, we definitely get a lot of what was I gonna say? PR. I was gonna say exposure, but that's not the word I was saying. Conference exposure in lots of different ways.
Nice play on words.
Yeah.
Yeah, that's funny. Mowgli. All right. What about you, Rhonda? You've been to Coronado Springs a bunch, right?
A lot.
Yeah.
Yeah. I mean, Coronado Springs is so nice. And to Claire's point, and especially it's super nice if you are an outdoor person and like to get up early and run around that lake. And that's a lot of fun. So I am not a diehard Disney fan, but Coronado Springs, perfect.
Get away, relax, and
Yeah.
yeah, some warm weather. Nice. So what about you, Heather? You've been a few times, you said, right?
Yes, yeah, I've been a couple of times, and again, it's been a lot of fun. We got to I got to go to some of the parks and enjoy it. Took my mother, who was in her 70s, late 70s then, and she was a first time attendee, and that was so much fun because they really do nice things for first timers. And so if you get the pin and have that it's really cool. And she enjoyed it a great deal. It was a lot of fun.
So we talk a lot about HealthCon as individual attendees going to HealthCon, but we also want to focus on things that you can take back to your business and kind of the business or not implications, but knowledge that you can take and bring back to your organization. Is that something that any of you had experience with going to a conference, maybe as a team, or just being able to take those things back and give presentations to your team about the things that you learned at HealthCon? Anybody have some experiences like that they want to share?
Sure. I've been to every single AAPC conference, national conference since 2002, with the exception of one, which was Long Beach. I kind of feel like there needs to be a do-over there because I never got to go. And then since being an employee, all the regional ones, right? As well. So that's a lot of years. But in business, our companies always want us to go because it's good business. And if you can take a team, it's so much better because you can divide and conquer. So you can get the presentations and learn from their PowerPoint, but you don't get the context and you don't get all of the information. Quite honestly, anymore, I use a lot of pictures on mine because people take the bullet points out of context. You just don't get the right thing, right? So I think as a business, the value that you can get, this lineup of speakers that we have and the committee that we use, the education committee, to help build and bring in those speakers, world class and from all different business sectors. You can't attend them all.
I've been thinking about this question, and I would add to this, if you're coming, and it depends on where you're at in the organization, but most of the time these would be protection coders, managers that are coming in. So they're either middle management and maybe even an employee. But what we bring or what happens in conference are things that you can do, things that improve your game. And so if you're sending your coders there and allowing them to learn these things, make sure that they're up to date with all of the rules, the regs, and how to code things. They don't have to come back and sell the C-suite necessarily on how to do something. They just do their job better. It is something they can do. So it improves just from the bottom up, if that makes sense. So, and I've been a number of years and I've never walked away not learning something new. Most of the time I've walked away very surprised that I didn't know something, or really excited that I did learn something I had no idea about. Like we said, lots of speakers, a lot of information.
And I would add that sending a group as opposed to just the manager or just one employee, you're going to strengthen your team just by unifying, by that camaraderie. And that actually is so important. As a manager, I loved when my team could get together and collaborate, but also on a personal level, right? You get to know each other a little bit better. You have fun stories, you have fun memories to share. And that actually really strengthens your team and makes you work better together. So there's lots of aspects to consider.
Right. Yeah, and we can see that a lot of cohesive teams or people that come to conference, and you can tell they'll even come together wearing matching shirts and everything, and it just looks like they're having a great time, but also, like Rhonda was saying, able to divide and conquer, go to different sessions and bring back just even more knowledge to their whether it's a clinic or a larger hospital. But I know we talk about this a lot when we talk about HealthCon, but a lot of people see the price of HealthCon and they're like, oh, I can't really do that, you know. But what are some creative ways that we can get more people out to HealthCon, or that they can get themselves out there by maybe even leveraging the place that they work at? Like, what are some ideas there?
Well, I mean, always, just approaching leadership and explaining the education value. I know that a lot of hospitals, facilities, they have an education budget. It's there to be used, and this is an excellent way to use it. And if you need to pitch that to, the C-suite, I think that you can make a really strong argument for that.
I think that health cons, the way that AAPC, and I'm saying this as when I wasn't AAPC, the first time I went to conference, I think my jaw was on the ground most of the time. I was in such awe at how differently it is ran. It is truly education driven. It is, and the camaraderie that builds into it. So it's you think about, you learn more when you're laughing. You can remember things more when you're happy. The camaraderie in there, the way that everybody gets excited, it almost like opens the neurons, I guess. And so understanding and letting, and for C-suites to start understanding that this is education driven. There are fun things that happen. We have a good time. We laugh. Those are all very important things, but it is about learning. And the topics that we choose are topics that we know can be troublesome. They're the gray areas that coders fight with every day. And so being able to stop a denial, being able to understand something just a little bit better, the cost of it is really insignificant when you're able to stop somebody from coding something wrong a number of times. So, you have to weigh where that return on investment is. And I know that can be difficult to do, but I do know, and I've even looked at the agenda this year, it's really driven towards those things that are either very important to us in the revenue cycle right now, or things that are very difficult in the revenue cycle right now.
Hey, Dave.
Yeah.
I'm going to tag on to that real quick, but I just want to give a shout out to Myra and Lori, who are they are all over not only social media generally, but when they go to conference, they share so much about conference and what it's like. Lori and Myra, if you guys would share in the comments your favorite things about HealthCon, and I will send you some swag. Uh, just share. I don't want to give you any directions, and just share from your heart what you love most. We did give away something to Melissa Roberts. She's going to the San Diego meeting. But circling back to Heather and Claire, just thinking about um, when I attend conference, many people, many members that I speak with, they have their employers pay for it. And just thinking about how that might be tough it's like asking for a raise, right? Like I'm just maybe introverted and shy and don't want to rock the boat. But what if you went to your employer or figured out what these are our pain points within our organization and do what Heather did, look through the agenda and say, hey, these are our pain points. They are covering these things at HealthCon. Claire, when you went out with your team, did you how do you prove the ROI on attending conference? I mean, it can be tough, I'd imagine.
I'm sure it definitely can be tough. I was very lucky. I worked for an employer who was all about it. So, what I would say though, for those people who feel intimidated by asking, it doesn't hurt to ask. Like literally the worst thing they're going to say is no. But I think that you can very easily sell them on it by just like you said, going through where are our problems. There's always going to be problems. I worked for a surgical specialty hospital, and there is always questions like, how do I code, orthopedics? How do, am I doing this general surgery correctly? And there is always going to be something addressed that you can present to your employer and say, look, I can get this information from the experts, from the mouths of, and also the networking aspect as well. You can meet people who are experts in these situations, these specialties that maybe you aren't, and maybe you're bringing in a new specialty to the hospital. I don't know anything about podiatry, and we have a podiatrist coming on staff. There's always going to be an angle that you can tackle. And again, it never hurts to ask. You're not going to get in trouble for asking.
Especially when the whole premise of HealthCon is revenue cycle and
Exactly.
improving accuracy and decreasing denials, right? It has to do with the health of their business. So it'd be really hard to not sell them on, hey, I'm going to go to this place that's going to teach me how to make your business more successful. Have
And
less.
if you think about all of the business side of healthcare too, we hit all of it with the agendas with HealthCon. We're getting how you're going to be a better compliance officer and where to look for and how to keep your company more compliant. But we're also giving those managers the tools that they need to benchmarking, right? How to manage people better, how to lead. There's a lot of things, how to deal with conflict. A lot of things that they can take away that's going to make them so much more valuable in their jobs.
Yeah. And not only as an attendee, but also as speakers. The three of you are speaking, correct?
Correct.
Do you want to give us a little bit of a rundown on what you're going to be speaking about? Maybe starting with Rhonda, we'll go to Claire and then Heather.
Yeah, so I'm really excited about the one session that I'm doing with Jacob, who's also on the National Advisory Board. We were talking one day, and it happened to be during a very stressful time for both of us. And so, my joke to him was, how can I get, like, how do you get something across? So it's really the whole thing is how to deal with conflict, the right way to say things when you really just kind of want to, force your way through, which will get you nowhere, probably fired. How do you turn that around and use the right words to get the attention that you need to get things solved? And so it kind of turned into this play of like, how do you speak up and still keep your job? How do you speak up and still get to be that leader, right? And effectively change and lead that change. So I'm really excited about that one. We have a lot of fun things in store for that. And then the other one that I'm doing is a compliance related one on how to audit your compliance plan.
Wait, your compliance plan. Ooh,
Yeah.
sounds like a hybrid of
Whatever we do
auditing and
needs
compliance.
audited, right? Yeah.
Yeah,
Yeah.
everything does, yeah. Great. That's awesome. So what about you, Claire? What are you going to be speaking on?
So this is my first time presenting, so I'm pretty excited, nervous, excited. But I am going to be talking about single path coding. I'm not sure if you're familiar with the term, but basically it's when one coder handles both the facility and the prophy, instead of having the separate silos that is pretty standard for our job. So anyways, I'm going to be taking a look at just kind of how that looks at a high level for the coder, and then comparing, contrasting all the guidelines that you need to know, kind of the ins and outs of the mental gymnastics that are involved with being a single path coder. And then my favorite part, we're going to have some fun looking at some operative cases and looking at what it looks like to code it inpatient versus CPT versus outpatient prophy.
Hands on then.
Yep.
Did you say single pot coder? Like
Single
yeah,
path.
path. I'm thinking
David
like a
Kaiser.
pot. Well, I'm thinking of the pot at the end of the rainbow, like a pot of
Right.
funds, a pot of money. It's just it's
We
all
could
coming from
rebrand
a
it.
single pot, so you gotta like. Never mind. Thanks. Cool. Single path. All right. What about you, Heather? What are you going to be
So,
speaking
so I'm going to be talking about the principles of the principal diagnosis, and that's actually the title. Probably it seems to be a moving target for folks in terms of the inpatient coding is what is the principal diagnosis, and getting everyone to understand this definition, and how do you decide what clinical data makes it fit as a principal diagnosis versus a first listed or a primary, which is a different concept. And so we're going to be looking at that and walking through a case or two that are going to be difficult to decide which is the principal diagnosis, and be able to walk through that together and see what we look at. But it's a hot topic, and it drives the DRG, which drives the payment that the hospital is going to receive. So you have to know what the principal diagnosis is.
The principle of the principle. I love it.
Mm-hmm.
Principal, primary, first listed, you said, and they're different.
Yes.
Man, so much to learn. I got to go to that one too. I'll add that one to my agenda. Man, maybe Alex can go. We'll go as a team.
We got it. We'll conquer, divide and conquer, Dave.
We'll divide and conquer. Yeah, we'll take all of our copious notes. But my question, I guess, is have any of you been in a position where you've sent a team or sent some employees to conference? Is that a position that you've been in before? And was that pitched to you, or did you just suggest it to your team? Or I'm just curious if, what the other side of that looks like.
For me, I've done both. I've pitched it to my teams to help build them up and help them get to where they need to be. But also I've had my team members come pitch to me of, can I go? And here's what I think I would get out of it. And I'd have them outline, right? And tell me, what do you think you'll get from it? What are you going to do while you're there? Right? Because you don't want them to go and hit the pool or the Disney rides. There's time for that, right? But
Right.
you want them to, the first objective should be the learning.
Cool. And Claire, I saw you nodding your head. Have you had or sent some people to a conference or had some other team members go? I'm curious when they come back, if they like a reporting, do you have them do a little
Do presentations.
little meeting? Yeah.
Basically, either pick their favorite thing that they learned, or if there are things that we said, oh, this specifically needs to be addressed, then they will go over in the presentation with the rest of the group during a team meeting. And so everybody can benefit from the knowledge. But yeah, it was my team. It was a few people got to go as a kind of a incentive. If you meet these metrics, then you are eligible to be, possibly going to HealthCon. That was a big incentive. It was great.
Yeah, that's fun. Yeah, make it a competition. If you're in a position like that and you do want some employees to go, yeah, make it exciting, make it fun. Why not? Good ideas.
So when I was over corporate, I actually did both. For me, it was a no-brainer. Like I said, after the first time I went, I knew the education was there. And so I actually talked my team into coming together, and we worked remotely. So we were all over the US. And so we would come together. So not only would it be a conference for learning, it would be a mini conference for us, so that we would go through work related stuff and work together. But I had to pitch it to, my C-suite, and talking to them about it. And it was well worth it to go, on top of just the team building that you can do internally, with having fun, and then the team building externally, coming back with new information. And so that's what we would do. We would do presentations, and that would be our continuing education. So each coder would take the topics that they watched, and they would do a summary of it. And every month when we met, we would go over that topic. So not only did we get it the week that we were there for conference, then it would spread out over the rest of the year for us to be able to learn kind of in depth how this affects us and what we can do with it.
Our refreshers every week. And those sessions are also available on demand. So you can watch those. You could watch them alone. You can bring those back to your team. Why not? So we're all about the education. And like you've all mentioned, we do have fun there. And it's not like, oh, we have so much fun that we have to kind of hide it and say there's just a little bit of education. No, it's all about the education. We have to make sure we pack in some fun so that it doesn't get too overwhelming, because it's a lot, but it's well worth it. So, Alex,
Can I
sorry.
ask I just wanted to add one thing, Alex, when you were saying about picking out the agenda and doing that, I think another important aspect of HealthCon that AAPC does is the speakers that are there are usually there the entire time, and they're approachable. So if you have a problem, let's say you say, okay, I've got this problem here at work, and I see that this is on the agenda. Rhonda, I wonder if I could email her and say, I'm having this communication problem. Are you going to touch on this? Maybe can we meet and talk about it? 9 times out of 10 is going to be a yes. So the speaker will meet with you. They'll meet with you for lunch, and they'll talk to you about it. Or you might see them in crossing, in passing, and stop and talk to them. So the speakers are accessible. There's some people who have to leave. They can't stay. But the majority of us, we're there for the time, and we want to be there, and we want to provide the information.
We give out our contact information for a reason, right? And people use it with me all the time. It's great. It's that continued networking. It's that building off of those relationships, and it's great.
Yeah, I love that. That was something that was surprising to me when I first started with AAPC doing webinars, is that we allowed everybody attending to just openly ask the presenter questions, and they're giving live feedback and just able to, it wasn't this like lecture format where we're just listening. I think we've always kind of encouraged participation from our members, because that's really how you learn, is just diving in and getting that two-way communication. So thank you as speakers for being open and available to be contacted, and for doing such a great job. So, well, we're almost out of time. Alex, is there anything you want to add, or you want to?
Well, I feel like we've pitched the reasons why on a professional level. I mean, that's what it's all about. We've really hit it hard, and if you've attended, you know. But I'm going to swing it back the other way in the fun that we have. It is so much fun, and what keeps me at AAPC is my relationships with, Rhonda, Heather, Claire, Dave, and then the members who are on here watching. Myra, who's now part of the CAB, Lori, we've known each other for years now, Corella, just amazing people who I can say with 100% sincerity that they have your career interests in mind. They want you to be the best that you can be in your profession, and they want to help you fulfill whatever vision that you have of that career path. With that, it gets weird in the fun ways at conference. It's like fun and silly, and for me, like super awkward. Some of the things that Dave has had me do and other people, but it's tons of fun. It's a place of growth for even me, who's not a coder, guys. So yeah, looking forward to seeing everybody.
Yeah. And it really is about the people, right? That's why we get together in person, is because it's about the people and that connection with each other. And we're going to learn that way. So, well, thanks everyone for joining us. Rhonda, Claire, Heather, you're all great. And Alex, as always, so fun to be here with you.
Thanks for having me.
Thank you very much.
All right.
Bye.
Okay.
Thank you.
Hey, we'll see everybody in 3 weeks on the next social hour, because it's the second week of February is 3 weeks out, the longer January.
Good.
Okay.
Here you go.
All right. We'll see y'all then.
Thank you.
Bye-bye.